Hey, Dr. Deb Matthew here. I am really looking forward to the spring event with the A4M. I am going to be talking this time about mood because it's such an important factor in how we feel, and how we have been managing it in medicine just hasn't always gotten the greatest results. You know, if women or men march into their doctor's office to complain that they just feel kind of flat, tired, irritable, anxious, they're just not at their best. They don't feel like themselves. They know that something is off. We almost have a knee-jerk reaction to start writing on our prescription pad for antidepressants and anxiety pills or sleeping pills or birth control pills. And the problem is that almost always the underlying thing creating the mood disorder is not a Prozac deficiency, it's not a Xanax deficiency, it's not an Ambien deficiency. But if we can help people understand what the real problem is, maybe it's a hormone imbalance, maybe it's nutritional deficiencies, maybe not enough omega-3s, not enough B vitamins, usually a combo of all of these things, often because their lifestyle habits aren't so ideal. There is so much that we can do to help our patients restore their health naturally so they can get back to feeling like themselves again, and they don't have to deal with the prescription medicines. Because if you think about it, if someone is feeling maybe a little down, and then we put them on an antidepressant and they gain weight, then they feel worse about how they look. And we suppress sexual function, and then they don't feel good about that. And so now we've just added more reasons for them to feel down, and we kind of made things worse. So if there are alternatives that could really help people, that's what we want to know about, and that's what we're going to be talking about.